All right, guys, so let me run you through the process of how you adjust the lower back, okay? When a patient comes in, first thing I do is assess the patient's range of motion. So I'm not moving the person just to move them. What I'm assessing is their range of motion and if they have any restrictions, okay? So for instance, with her, what I will do is I will rotate. And at this point, I'm trying to figure out where she's locked, okay? So in her situation, right at this point, is where I feel like she's locked, okay? Then we rotate to the other side, and this is the point where she's locked, okay? So I'm getting more information as I do her range of motion. Another plane that you can assess is the extension portion of it. So for her lumbars, typically what I'll do is I'll bring the person into extension, and as I'm extending them, I am assessing at what point is she locking up, and this is where she's restricted, right at this point. We can also do lateral flexion to gain more information, which is side-to-side motion, okay? Side-to-side motion. So the next thing I want to do is palpate. And basically palpate is just a fancy medical term for touching and pushing and feeling, okay? And what I'm palpating for is muscle tension. Go down to the lower lumbars, palpate, see how tight she is. See, what you have to understand is you can gain a lot of information by just touching the patient. So before you adjust, you have to understand how far is that person moving? Where are they restricted? You know, are their muscles tight? All that will give you information on what's gonna happen with the adjustment. When I first started practicing and I have like a huge or bulky person, you know, and they'll come in, I'm like, oh my gosh, you know, I'm terrified because I know it's not gonna go well. Typically, bulkier people, you know, they're very hard to adjust. People who are slimmer typically are easier to adjust. It's not always the case. Sometimes you have people who are slim and they can't really, you can adjust them. But you know, this is the type of information that you need before you start to adjust the person. Now, understand that when you start practicing, you're going to have people who have never been adjusted, ever. Okay, now to be on your side and you know you're positioning them, sometimes it's very awkward, okay? So you always have to coach your patients, all right, and also position them. But positioning is very important. So the first thing we want to do, her head is right in that groove, okay? The reason why it's not able to shift forward, backwards, side to side. So this stabilizes her head. The next thing we want to do is position her shoulders. Okay, once you get her shoulders positioned, you want to take this hand, have them hold on to their arm, okay? So some chiropractors will use more of a drop technique. Some will use more of a kick technique, kick type of pull technique. But with me, I use a hybrid. Now, positioning is important because what you're looking for is tension. So without creating the right amount of tension, it's very hard to have a successful adjustment. So the first thing you want to do, you want to bring the patient inward towards you. So your body move closer to me. Good. Gonna rotate your hip like this. That way, when you're ready to adjust, you have more leverage and then you can create more tension. In comparison, if I had it like this and then I'm ready to adjust, I'm not creating as much tension as I need. So once again, I'm gonna bring her in. Good. And the leg that's on the bottom is going to be straight. I'm gonna straighten this leg out, okay? Now this leg, we're gonna bend this leg, like so, okay? Now understand that with newer patients, or people who have never been adjusted, when you're putting them in that position, they tend to guard, you know? So with her, she's been adjusted before, she's nice and loose and relaxed, but typically, the folks who have never been adjusted, once again, understand that this is a very awkward position to be in. When you start to bend their leg, usually they're really tight. So they're holding on and fighting you, okay? So you wanna make sure that the patient is very relaxed, because if they're not relaxed, once again, it may be difficult to adjust. Okay, so with this method, patient is using this hand, holding onto her arm, and I am reaching in. Okay, now, this is important. Once I'm in that position, I am stabilizing her thoracic spine, okay? At this point, I can control what happens to her torso. I can have it forward, I can have it backwards, okay? Now, some other techniques where the chiropractor will do it this way, and they can control it that way as well. This is typical for more of a drop technique. You can keep your legs straight, where the chiro will come in, contact the lumbosacral region and drops, right? But with this technique, I'm actually controlling what happens to her upper body. Now, this is important because once I have the patient rotate for me, good, okay? This leg is straight. Now, I'm using my knee against hers. If I have her twisted, what's going to happen when I thrust is going to get the upper lumbars. If I have her positioned where it's more aligned, there's going to get the lower lumbars in the lumbosacral region. Okay, so now, if you guys notice, she's almost kind of like falling off the table. So this is why it's important to rotate the hip, okay? So in that situation, we're going to take the hip, rotate it inward, have her hold on a little tight. Okay, leg is straight. We're bending this leg. I want to focus on the lumbosacral region. So her torso, I'm going to keep it straight instead of twisting it all the way. Then I want the patient to have to take a deep breath and then let it out. Now, the reason why it's important to have the patient take a deep breath and let it out, it's important especially for people who can't relax, right? Because when we take a deep breath, we're tight. When we breathe out, at that point, you have no choice but to relax. So you want to deliver that thrust at that relaxation point. So deep breath, out, and then boom, then you adjust, okay? So now what I'm doing is I'm creating tension. Bring her in a little bit, good. Come in a little bit more, perfect. This leg is straight, we're bending this leg. Deep breath for me. Out. And that's the adjustment, okay? You've heard the adjustment. So basically what happened, I got her into position. Her legs were straight. And then once I reached that point of tension, which is right here, okay? So basically this is the point where I can't move anymore, okay? And once she's at that point, then I can apply the thrust. Now, you can contact the lumbosacral region, apply it. Me, personally, I'd rather use my forearm. It's more general, but it gets the job done. And then you want to thrust and kick at the same time. Okay. All right, so how'd you feel with that lumbar adjustment?
Feel really relaxed. I feel good. Feel a lot looser, more flexible.
More flexible?
Yeah.
Okay. All right, and this is how you adjust the lumbars. Once again, there are different ways to adjust. You could use a drop technique. You could use a pull technique. And in reality, when you start to practice and as you gain experience, you want to do what works for you, okay? There are certain things that they teach us in school, for example, contact points and things of that nature. That's all well and fine, but what you'll find is that it doesn't work for some people, okay? So you have to do what works for you. Perfect. Okay, let me get the other side real quick.
Okay.
So face right here.